www.healthcmi.com, the Healthcare Medicine Institute, acupuncturist continuing education online. Welcome to the presentation of TCM Dietetics plus Cardiovascular and Digestive recipes. Today's pre-recorded webinar can be taken 24 hours a day, 7 days a week, and this video features myself, Adam White, licensed acupuncturist, and Professor Jeffrey Pong, who is one of the founders of the curriculum of Five Branches University and department chair in the clinic, theory and herbal medicine at Five Branches University. So in this webinar, we'll be exploring cardiovascular and digestive recipes. We'll be looking at individual food items, traditional recipes, and dietetic cures for these ailments. At the end of the webinar, you can go to www.healthcmi.com and take a quiz. There's no time limit on the quiz. If you need to retake it, you may. And then the system will automatically, once passing, generate a certificate of completion for your acupuncturist continuing education credits online. I hope you enjoyed today's presentation on TCM Dietetics plus cardiovascular and digestive recipes. Please remember to log in with your username and password before taking the quiz. That will get you access to the courses, tests, and quizzes menu item where you simply select your profession, in this case acupuncturist, and that gives you full access to download supplementary information, which are links to this course, for example, and take your quizzes and get your certificates of completion. Remember, we also sent you your username and password in your email, but also if you have difficulty, go to contact us and ask us if you have forgotten that and do not have that. This is something you entered when you first purchased the course. So again, remember to type in username and password and then go to the courses, tests, and certificates menu item to access your PDAs, your CEUs, your CEs, your CAEs online.
Hi everybody. So we should be started on the first will be the coronary arterial disease. So that's what the mostly common disease, not only in the United States, actually in the whole world. Why then? Because now everybody know, because the dietary situation changing. On the before, something we can make example like in Hawaii. So then people will be eat more like all like organic food, or like the fiber, or many grains, or yams, those kind of condition. But since become a part of the United States, so then all those kind of modern diet, those kind of food, for example, like all those kind of soft drink, so then all those kind of like fast food, then like hamburger, those kind of things. Then people daily basics to eat those kind of food. Later on, all those kind of native people, they become all get the disease, same as like mingling on the United States. That meaning they have many more like diabetes and also obesity, but many people also had heart disease too. So we can give you another example, like in China. Before, because the economic is kind of low, people is poor, like on the countryside, people only just eat rice, vegetable, yam, all those kind of things. Then they will be like kind of skinny, look like unhealthy, but actually they don't have many something disease like heart attack, high blood pressure, diabetes. But since the economics is improved in China, so that many people will be started to follow American diet. So that will be what? Mainly like people can eat fast food, or even though like McDonald's, they have many, new open shop in China. But in the local, they had something kind of fast food chain to be provide those kind of, many is the deep fry, greasy oil, those kind of foods. So now they started had the same kind of condition like here. Like the first, we put it in the bottle, say first bottle, second bottle, third bottle. Then also third bottle, those kind of people, they changing to be, if the economic better, then they will be changing to the same disease like, the first bottle. That meaning what mainly is related with the diet problem. So now I just come back from China not too long ago. I had many friends in China, classmates. They already put many stents on the coronary arterial because they had narrow or had something like crack over there. So then they can be imported. On the beginning, they imported all those kinds of stents from like first world or like United States or Europe. Or even though now they started to have make their own stent system in China too. But actually, people just know it when they had the coronary problem, so then they will be put a stent. But how about any method? We cannot put any stent on the coronary arterial. It's prevention. So we don't have to do that because we change in the diet.
I know someone, I got an email this morning who just had stents put in. They opened him up and 95% blockage.
Yeah.
One of the difficulties, of course, with the coronary artery is it's almost impossible to perfectly visualize what it looks like until someone actually looks inside with a camera. So there are MRI techniques and ultrasound techniques and laser techniques to take a look. They're not perfected yet. I'm looking forward to those things being perfected so the diagnostic procedure is not as invasive. Today we'll obviously be going over a lot of techniques of how to eat properly so that we don't ever, hopefully, need to get into those situations. Naturally, a lot of it is genetics, but a lot of it is definitely also dietary, and so we'll be taking a look at that right now.
Yeah. Okay, so then I think on the last seminar, we mentioned one of the kind of simple combination, just 3 items. If we know how to handle it to, like daily basics, to be drink as like a tea or just, eat something like a pickle, so they can be have very good effective function to prevention those kind of disease. One of the kind of is we can consume herb, but also can be consuming food is shanja. That will be probably we can even though grow in the North America is we call hawthorn.
Hawthorn berry is
hawthorn berry.
shanja, usually dried in cakes and biscuits, candies.
But in here, I think no people selling, like native shanja in the market, right?
I have not seen it.
Yeah.
No.
So that is look like very economic. Kind of the fruit, they are kind of sour. But if we know how to handle it, so then we keep continually to be taking the shanja as a part of the daily basics, dietetic, the recipe. So then people can get many benefit from that.
And I wanted to just make a quick insertion here that the concept here with dietetics is that over time, the coronary arteries build up blockages slowly, but we can also slowly clear them. So using hawthorn berry in the diet every day, and there's many ways to do that. We'll go over that. Saffron, shallots can be replacing shiebai. We'll go over these things in a moment. Will prevent long-term blockage, and then we don't need stents, we don't need surgery. But this is a terrible problem in the United States, very serious. And so these are some techniques to protect the coronary artery.
But people need to know how to handle those, free that item. Because shanja is good, but people will be reporting if you just only use the shanja and use it very concentrate, like make the the tea or to drink, but can be cause another problem. Because some people will be actually in the later we talks about that too. In here we had many people had whatever called GERD or whatever called stomach ulcer. The problem is the stomach had producing too much acid. Then shanja is sour, so then if we not really know how to be exactly handle that, you just say, you eat more shanja, then people can be have problem with that. Same as like we know that like a stent, we put it in the arterial on the heart, but the doctor follow up had to be take something like blood thinner, such as like something like aspirin, those things.
Coumadin, warfarin.
Yeah, Coumadin. Then
aspirin.
Later on, actually, what happened that people can get bleeding.
From the aspirin.
Yeah, from the acid or stomach ulcer. Okay, so then we be what? We need to be how to exactly to be help the ask the patient to be moderated. Sometimes good, but we need to be see different people had different kind of stomach condition. If they had too much acid, the combination, the percentage, you still can put shanja, but it's not that too much. And otherwise, they can be, it's because the sour. Then they can be had, the problem with the stomach. Then the honghua, same thing too. It's saffron, but for economic reason, saffron is good. It's very expensive. So then we can be replaced by like Sichuan honghua. That is another very economic, herb related with that saffron family. So we actually, the saffron, when we talk about the oil, we had one of the kind of oil is come from, I think they call not saffron. It's a little bit different, the oil, like honghua oil, we can selling in the market. So then we be what? There we be has some similar effect. It's like honghua. Okay, so then when we use it that's kind of the saffron. So then we can be put it in the tea with the shanja. Okay, but the percentage you need to be adjusted. Like we mentioned before, if the stomach is too much acid, so then the shanja, the percentage will be lower. Okay, then the honghua, there will be what? If is in Chinese medicine system is putting in mercury in the blood. So if some people like they during the female, they during the menses or something, or whatever the people who had the bleeding problem. So then you put too much percentage of the honghua, they can be cause blooding.
Excess menstruation, menorrhagia.
But another item, that will be pretty safe. That just kind of onion family. The small onion, but we call in the pinyin, we call shiebai. But actually in here, on the local market, I think they just call shallot. Okay, people often need to be using that as like a cooking item in the kitchen. So do you eat shallot too sometimes?
I love shallots. So shallots are much larger than medicinal shiebai that we get from reputable herbal medicine dealer, obviously when we get the herbs, we like them vacuum sealed, unsulfured, without any phosphates or aluminum added. So we get good quality herbs. Xiebai is much smaller, much more concentrated. But in the same way that Chinese celery is stronger than American celery, so too is xiebai stronger than the larger shallot. But shallot makes a great culinary addition. It's easy to get and it works. It's just not as strong. So you may need to use more or over a longer period of time. Nonetheless, it helps unblock the coronary arteries. And great for, Jeffrey, angina pain, correct?
Yeah, it's correct. And also how to be eat that xiebai as a medicinal, level, we also had to know too. So we just cook as garlic, then we saute or with something another food. It's benefit, but it's not that strong. So then if we want to be stronger, so we need to be put the shallot to make like a pickle with the vinegar. Okay, then we will be eat daily basics, like a pickle.
Pickled shallot and vinegar. How long do we soak it in vinegar before?
Probably, couple days or something. And also depend on the people, see how the stomach condition too. Because you soaking too longer, so that is stronger, but, more sour.
Right, so difficult on the stomach a bit. Would you use Chinese white vinegar, Chinese black vinegar, or would you use even a straight white vinegar?
That's something too. We need to be see how the condition of the the body. So basically, we say white vinegar or whatever in here on the market we call the apple cider vinegar. They are very sour. So then it's good, but for same thing again, for some people who had the stomach problem or sensitive stomach, that will be too much. But we had another choice. We will be using the black vinegar.
Yeah, Chinese black
vinegar. Or we
vinegar.
call sweet rice vinegar. So then will be what? They are much mild because the taste will be, it's sour but not that much. And also will be has somewhat sweet.
Sweet, yeah.
So that's what the choice we can be use it. Even though if people who can tolerate that accent, so then even though they eat the pickled shallot, at the same time they can drink a little bit those kind of the vinegar with the shallot together. So that will be stronger.
Even stronger with the vinegar to invigorate the blood.
Yeah.
Okay.
So that is very economic. But like we mentioned, all those kind of dietetic program, we weren't expecting they can be immediately effect to be, okay, some people say, how do I know that kind of diet can be work for me, or how about 1 month or 2 months? So then we'll be before you do that things, you take a lab test to see how much cholesterol or something.
Right.
Okay. Then 1 month might be still nothing.
This is for years.
Much.
Yeah.
So we talked about that is had to be daily basics to do it for for a long time. Okay. So then definitely big fat.
Over time.
Yeah,
over several years, this is an approach to the diet that will protect the coronary arteries from buildup. It's especially good for people who've had a stent surgery to not have to need it again. So again, we take some pieces of sliced chancha, dried. Put it in a teacup, add some hanghua, and drink.
Yeah, that's another slide we can be showing you on the number 2. Let me see. Yeah. So that's another kind of the easy way to be do those kind of dietetic program. For example, what we talked about the saffron. Saffron is good, but if we just put the small changing or combination, put one of the ingredient we call sanchi powder. So then it's very simple, like it's just cup of the tea. How do that then? You just put because sanchi is like kind of very firm, okay, is baked. So the best way or simpler you put that sanchi is in the ground
powder form. Much easier.
Then when you put the honghua, put on the teacup, then you put the hot boiling water, then you add sanchi powder. You can put it in the another easy way. You can buy at something. Actually, now I can introducing some kind of simple, small things that can be very help make those kind of simple tea. So you can buy something like an empty, tea bag filter, something like tea bag. Okay,
Mm-hmm.
It's empty. So then you can buy something made from organic
cotton or even
cotton
paper.
or paper or something. Then you put those honghua or sanchi powder or even those small pieces of sanchi. Then put it in the empty tea bag.
Mm-hmm.
Okay. Then later on you put it in the teacup. Put the high boiling water over that.
And steep.
Then you can take out the tea bag just like regular tea bag. But that is your own tea bag because all the ingredients inside you can be control. You can make some changing. Like we mentioned, number one, we just put the sanchi and honghua.
What about everyday drinking tea, like a nice pu'er? Also a good habit,
Mm-hmm.
not the same medicinal strength as a honghua sanchi powder tea or even with shancha,
Mm-hmm.
but the pu'er tea that we love to drink during our webinars does lower the cholesterol, so it is helpful.
That taste you can be, according your flavor, you can make something combination and change it.
Right.
But that's what we talked about that.
So pu'er, mix it with a little sanchi, mix it with a little honghua, maybe add some shanja.
Yeah.
And now we have the makings of a very healthy diet. These are good practices in the morning, as opposed to waking up, having coffee with cream and sugar. Mm-hmm. This does nothing for the coronary arteries. We're going the other direction, and suddenly we've built in one aspect of a daily diet over years and years as these problems build up. So again, this is not for an acute emergency. All dietetics are for long-term chronic issues.
Yeah, like you say, they had years to build up. Just like something like we on the solar system, okay? So then what? Now we use that method, we be same thing, year to be dissolved, okay? So the same time, okay? You have many time to build up, then we have many years to be dissolved. So that's what the idea. So we talked about just like a pylite system in the human body, those kind of arterial system. So then inside will be clogged that by what? By the cholesterol thing. They attach on the the lining. Okay? So then actually that's one of the questions by some patient today asking. If we take those kind of whatever dietetic treatment or something like even though stronger like a formula treatment, is it the blood clot can be dropped off? That will be to be along with the circulation system, then can cause what? Like a stroke or heart attack, because that the clots can be dropped off.
Right.
Okay? But actually, like I just mentioned, that procedure will be what? Like same kind of system, like we build up the, like a pylite system. The things in clot in the inside, it's not the completely, the whole one take off.
Right.
Not like you said the rotor.
Roto-rooter.
Then they will be put the things to be clean, make them all completely come up.
Right, right.
That will be problem. That's what sometimes that's why they put a stand over there, because first they will be open up the arterial, then later they put the stand over there. That because after that something can be drop off a little bit, or something can be make the new clot. then later on will be, get the stroke.
Correct.
That's what they need to be immediately give the, the blood thinner.
The warfarin
Okay,
and the
but in
Coumadin.
like that kind of system, we mentioned this like that. How many times you build up those kind of problem? There will be how many years to be, how many years to build up that thing. You need to how many years to dissolve them, to be take off them. So it's just kind of long.
Long term,
process.
not as
Long
dramatic
term,
as
no.
putting a stent
and
in.
no dangerous situation too. Like some people say, after we do that kind of dietetic thing, should we have something like risk because the blood clot can be dropped off? I don't think so. At that kind of situation.
So we get a lot of questions like that. So obviously, there's very low risk. It's not like a surgery where it's a big deal with warfarin. These types of things are safe to use over time. And another question we also have is what is the minimum dosage for each ingredient to be effective? And so this is something, this is cooking.
Yeah,
so a little bit,
It's not
every
like
day,
you take
every
the
day.
medication, that dosage, say, 3 milligram, 3 times a day or things like that. It's not the idea.
Right. So again, this is a casual culinary approach. And what we're attempting to do is put a little pu'er, maybe take a pu'er tea bag, take a few pieces of shanja, add a little hanghua, make a little sanchi. As long as one, it doesn't upset the stomach. And two, it can be done long term, maybe at breakfast and at lunch, or just at breakfast or at lunch every day, or at dinner, like that, day after day after day. So the concentration of, 3 grams, 1 gram, not that significant, except as we pointed out in the case of people with bleeding problems, a hanghua. If we use quite a bit, obviously, that could be an issue. So, a pinch of hanghua will not cause a problem, or a few pinches of hanghua. And if the bleeding increases a little bit with the menstruation, for example, then obviously it's a good time to lay low on the hanghua and maybe use the sanchi with the pu'er and the shanja and mix it up like that. And again, sanchi is great because why?
Yeah.
It stops bleeding, but also promotes the blood circulation.
Yeah.
So what could be a safer, better herb to use?
Yeah.
I'm always fascinated by that, Jeffrey, that an herb can do that.
Yeah. So, I give you another information too. Like some people reporting, when they taking the something like ginkgo biloba, then they can be cause, bleeding. So that's why some surgeon, when they, advise all the patient before the surgery, they had to be stopped, all those kind of things. But because in the market, the ginkgo biota, to make that pill, they will be using something like a pharmaceutical method. Okay, they are not exactly. It's like what we do the dietary.
Yeah, it's not a raw herb; it's an
dietary,
extract.
You always never will be over because the body can adjust. You drink like water. You drink such amount, so you be feel enough. So then you won't continue to take that. Okay, so then like you eat something, same kind of condition, but you take the pills, that will be different.
Right, easy to overdose on pills.
Yeah, you can be those.
And the ginkgo in the market is the leaf, not the nut, which we use in Chinese medicine. So it can raise the yang qi very extremely.
Yeah.
Even though it might be good in deficiency patients to raise the yang qi, can also make a lot of headaches and maybe even cause problems with high blood pressure. So we have to distinguish the ginkgo in the modern marketplace. One, it's a different part of the plant, and two, it can be hyper-concentrated or extracted. Again, one is not going to run into difficulties with these ingredients in the raw form because they're so mild and gentle. And the same thing for red yeast rice, which also does have lovastatin in it. But if someone uses that as a garnish rice on dishes, one is not going to have a problem with red yeast rice. Now, it's different if we hyper-concentrate it in 10 or 15 or 20 to 1 extract into pills and then take handfuls of these pills. That is like going to the doctor and taking lovastatin. There's no difference between that and a statin drug, except that it's a broad spectrum of statins, not just lovastatin actually has many statins, and it can actually have less side effects because it's a broad spectrum approach And so it's a very interesting approach, but it's not traditional Chinese medicine. It's using the concentrated drug principle. So we don't use that driving principle in Chinese medicine to take the active ingredient, hyperconcentrate it, and then cause an effect. Jeffrey, I had a question also that we get a lot, and that is what method can be used to detect coronary artery disease in Chinese medicine? And we get this from a lot of participants in our webinars. They want to know, how can we detect it now?
Oh, how could we detect
choppy
that?
pulse is probably number one. But.
Yeah, but no, not yet too. The symptoms also, same like the Western too. If people, they before they doing something like more like imaging or whatever, something like send the camera into angiogram. It's the patient always. You cannot, like for all the patient, they come, then you won't make order that kind of angiogram for everybody, isn't it?
Right.
So they need to be select some kind of, patient, they might be high risk. Then they will do that because that is expensive. So then same as like the TCM2, what we, detected then, of course we not really can be exactly like send the, the camera into the heart, but we had the symptoms. So then people in the TCM long time ago, we already had that kind of name. So we just call chest beat pain, called Xiong Bi. Okay. Then chest beat pain, of course, not 100% is come from but it's quite a bit large amount. So if the patient complain, say they feel something like
chest discomfort,
discomfort or sharp pain, or after they exercise, then we will be also come by, because in the TCM system we always have 4 methods. Okay, that's one of the we say asking. So the symptoms they talking. Then later we chat. They usually the whatever the lips or whatever the tongue, it should be a little bit more purple. Okay, then we check the pulse too. Okay, then the pulse it can be choppy or can be wiry or can be something like abnormal condition.
Stagnation.
Yeah, stagnation. So that's what we. Of course, you still can ask the patient, say, okay, go ahead to take something more advanced, technology to be checked. Like first probably something. Then later we put the camera to be finally
to take a look inside.
But we we get the symptoms is enough to be to do it. Whatever they, even though later on when they show up, say don't have that kind of coronary, but you'll be eventually be had that.
So look for those red flags: angina pain over the heart region, shortness of breath, unusual shortness of breath during exercise or walking, irregular pulses, choppy pulses, unusual wiry pulses, slippery pulses. Sometimes a sharp peak on the pulse, like the tip just hits you a little too hard to show blood stagnation, purple tongue. Also, purplish dots on the tip of the tongue also will usually tip us off. And if you see a patient with deep blackish purple dots on the very tip of the tongue, you probably know they've had some kind of injury to the heart, maybe rheumatic disease affecting the heart. Maybe they've had heart surgery. It usually shows up on the tip of the tongue if it's been around for most of a lifetime with permanent damage. And then, of course, one of the asking methods in Chinese medicine, family history. Genetics plays an enormous role in heart disease. So these are the red flags that we look for. And then, we refer it to the doctor.
Yeah, actually, in our system, we say, people who had the blood stagnation, but before that, they usually had cheese stagnation first. So then when they get the cheese stagnation, they not necessarily can detect that had those kind of, like purple tongue or something.
Right.
Okay. But it's enough to be diagnosed. Same like here, we say the, cheese stagnation report is somewhat look like under stress or those kind of conditions.
So, again, that just goes for cheese stagnation we should be looking for.
So we talked about those kind of recipe, we can be had some choice beside the sanji powder with the honghua. We also can be do it something like sanji powder with shanja, okay, and we same thing. The sanja can be just the originals, the piece of the sanja, then dip it in the water. But also we can be make something improvement. Again, you put the sanja, same thing too, will be powder up. That will be what? Same method, we can put it in the, the empty, the tea bag to do that. And another choice, even more tasty, then you can be, something like use it, people, because dietetics things is same like people daily, the food to eat. They need to be have somewhat changing, the taste and the somewhat changing. So then will be what? To be make them more attractive to the, to people. So then will be what? We can be using something like chicken or, something like lean pork meat or something to make soup first, okay? Then you put the, black, the mushroom, we call hamur, okay? Then sanji powder again, okay? So then will be what? To make the taste more, attractive to the people who, because they want to daily basically to do it.
So Heimu is extremely powerful. It's a blood thinner. It's very safe, though. People say, "Oh, well, how safe is Heimu Heimu is very safe. Again, it's over time. You're not taking Coumadin. We don't need to be intimidated by Heimu. It's absolutely tremendous black fungus, as opposed to the white fungus, which is more for lung yin issues and found in sweet soups. We go with the Heimu. So I can't stress enough how important it is to put Heimu in the diet. And Jeffrey's saying a nice chicken soup or a lean pork meat soup for Heimu. So
just the meat things, it just make the tasty thing. If some people like a vegetarian, they don't need to. But like I say, because you daily basics to eat that kind of things is too long, you'll be feel like a kind of not that good taste or whatever. You will be feel tired or that. So we need to make somewhat change in that. Okay, so then here just give you some idea. So the main things is you need to eat just more. Those kind of like a hammer powder, or in order to have like medicinal effect.
Again, that's the idea, is to focus the diet. Now, what ingredients are in your cabinet? What do you reach for every day? Are you reaching for cream and deep fry something, maybe hot and spicy? Well, these are the things we want. And Heimu should be on the cabinet of anyone who has any suspicion of coronary artery disease.
Yeah.
It's dried. It keeps forever. You can get it from your herbal supplier. It's available in Asian markets. It's easy to store. It's easy to order online. So you can soak it.
And economic, very cheap too.
Found it. You see it a lot in hot and sour soups in Chinese restaurants. You see the little black pieces. So Heimu.
The problem just because the Heimu by itself is no taste at all.
Flavorless,
okay?
but I find that an
flavorless.
advantage.
But then you need to be do something about to make more people like it to
Yeah,
to
it's a nice texture, and so with chicken it's perfect. Heimu and spice up the soup a little, and then go ahead and add the shallots. Go ahead if you can sneak in a little saffron, but not too sour. It could add a little balance if you're a very good chef. So again, these are the ideas. We're building up our culinary cabinet here today, and we're building a lifestyle now that will help people.
Yeah. Okay, so now we continue to we get something wisdom from the Huangdi Neijing about like 5 grams according to like 5 elements. So then will be what one of the kind we say the 5 grams associated with the heart, because now we're talking about coronary heart disease. So then will be what we need to be eat more like gao liang,
sorghum.
Okay? Yeah, gao liang in here might be of course you can buy it from the like Asian market. But I don't think you had much more chance to buy it from the mainstream, the like food chain store, like a Safeway, those kind of. Did they selling the sorghum?
You can get sorghum. It's probably the most popular grain in Africa. Less so here. Quinoa is definitely more popular than sorghum in terms of grains.
Yeah, so that's what I think we will be probably just replace to the, quinoa.
Yeah.
It really looks like a same kind of, the plant. The color too is the same. The size is the same. Okay, so that will be what, because the outside is very red, okay, and also will be inside will be have so much fiber. Yeah, I think on the left side that is the sorghum.
And there's a popcorn someone made with the sorghum next to it, so I thought that was fun to show a little bit. Very creative, but a very popular grain, particularly in Africa. But sorghum, very healthy grain choice when there's coronary artery disease. It's just making those correct choices.
The quinoa, I think that will be very simple and easily to buy it in whole. I mean, in a health store, but even though in the Costco, those kind of big
Costco,
chain, they also is organic too. So then, whatever we cook rice or whatever we cook like oatmeal or whatever we say, cook those kind of sorghum with something, another bean or something, then we put those things together. So that will be very helpful for the heart. That is, from 1,000 years ago, couple thousand years ago, Huang Di already say that, because we say that is the, associated with the heart. It's the red color.
So the redness, right into 5-grain theory, the redness of the sorghum lets us know that it benefits the heart. And then, of course, modern studies go ahead and now discover that the colors are related to different things. We find, reports celery benefits the liver because it's green. It goes right along with 5-element theory. So no big mystery here. Same thing with Honghua. It's red. Yeah. Definitely invigorates blood into the heart. Blood and heart being one and the same in the 5-element system. So look for the colors of foods in dietetics. They will always guide you correctly. And we'll go over some more of that with the colors of foods in a little bit. So yellow, orange for the spleen and stomach, chi, etc. So those are great guides when trying to make healthy cooking dishes.
And another, 5-element very related with the associated with the heart. In the vegetable, there will be now that kind of vegetable selling everywhere, even though including in the same way, but people not really know how to be exactly use it for, to be like a dietetic treatment. What's that then? That will be like chive. So I think the chive is also selling in the same way, but they are used different way in Western cooking. I think people just look like, chop it in pretty small pieces.
Right.
Then put on the potato.
Oh, it's nice that way. It's a topping. It's a garnish.
But when we want to be used more medicinally to associate with the heart, we need to be changing how to cook it. So one of the method, we say, if you want to be very medicinal, except to the chest pain, whatever we talked about, like angina pain, or on the before in the TSAM system, we also related with something like dita, something like injury, for example, like an accident, something, or spot, injury on the chest. Then people will be feel it, on the very sharp pain on the chest. So I can introduce one of the kind of very simple method to try. They can be very effective. So what's that then? Because like we mentioned, if you like Western cooking, you just put the chive, you chop it into very small pieces, then you put on top of something, another food like a
garnish,
potato or something.
Yeah.
Then just make the flavor. It's nothing related with the medicinal effect.
Not strong enough.
No. So then we be what? We put the chive. You can be put it in the not too small pieces. For example, like 2 inch or 1 inch, they kind of long. Then you chop it to like a whole bunch. Okay. Then you blanch. Then you eat just like as many as you can. Then usually you can eat like even though like 4 ounce or even half pound or something without problem after you cook. Then another stronger method will be what? We can be using the juice machine to be make the chive, make the juice, the fresh juice.
So juice the chives, powerful.
Yeah, there will be 韭菜汁, okay? Then we can be, again, add some red wine, mix it together. But that is like on the traditional, we don't have the red wine actually. But then you know what we learn the formula. I think everybody know it, something called 血白白酒汤 or 半夏白酒血白白酒汤 or things like that. 白酒 is one of the rice wine. Then in here, so the the red wine, even though more popular than the rice wine, then you can be using the red wine to be replace the whatever the traditional, we say the white
The
wine.
white sake basically
the sake basic,
is the traditional white sake from China, but then sake being the Japanese term for the wine. So baijiu, but in this case chive juice with red wine or with white sake, which we can get easily, Chinese white.
Yeah.
Also,
that's one of the recipe on the before, the Kung Fu master, when they had the school, the student get injury, because they practice each other, then they will be get something accidentally to be like punch the chest or somewhere. So then then the Kung Fu master can be immediately. Of course, they make something like di da jiao, okay, but that is another choice. Okay, so that will be what we just use the fresh chive, then make a juice, then we mix it with the alcohol. So then the alcohol in here is one of the idea is we call inculcating the blood to make the the circulation will be more active. That is something like just the agent, but the main function is still come from the chive. Okay, the juice. But if we say just eat the regular, we don't make the juice, but when we just eat like a veggie related with chive, that will be what? Because the chive has a lot of fiber. Okay, so then they will be have the bowel movement, but also will be what they have some dissolvable fiber too. That will be what? To clean up the arterial system. That's what the idea. So we get that kind of wisdom is come from the Neijing.
do you think too strong if we had siebai with the chives? What about shallots or siebai with chive?
Yeah,
Stronger?
definitely, yeah.
Flavor can be a little challenging. So,
because that's what the name, formula one, because 血白白酒汤. Okay, that is what, gua lo 血白白酒汤.
Right.
That is the formula later we for chest pain. So then the 血白, like we mentioned, is a shallot. Then 白酒 is this one. But then, gua lo, we can be replaced like those chive juice.
So backing up a little, the formula Jeffrey's referring to, gualo shiebai baiju tang, many formulas we use in Chinese medicine, we use water, 3-to-1 decoction, things like that. Here we're using the rice wine to go ahead and make the herbal formula. Here you add gualo and shiebai. In the case of this formula, it could be shallots. So think about using a rice wine or a red wine, which is more popular in America, and of course the red we know has the resveratrol and it's very good for the heart. So there is a lot of support for a little bit of red wine in the diet.
Yeah, do you hear about some kind of like folks medicine? Some people will be put like an onion, okay, then soaking in the red wine, okay, then will be what? That actually is kind of the, mixing, the Chinese medicine and the
Western
things, okay? Because the red wine is not traditionally had.
No.
We don't have red wine in the in Chinese wine industry, but that will be some people report that it's pretty good for prevention the angina pain, but also can be help. The cholesterol or high triglycerin too.
So it seems like it's, and what we're looking at with chives and shallots, it's the onion family in general. Mm-hmm. We know it dissolves phlegm. We know its character. We know it moves the qi. And so here we are getting rid of stagnation and dissolving phlegm. And this is something to open up the coronary artery. So the onion family is very good. Again, watch the stomach qi, watch the acid. Be careful with the yang energy in the stomach as not to upset it. Jeffrey, let me take a moment or two to go over just a few questions people will be taking a look at the end of the course. You can just go online and take a quiz. There's no limit how many times you need to take it if you want to take it again or need to. I just want to say that some of the questions you might encounter are things like forms of dietetics preparations include things like fresh juice, soups. They also include tea, kanji. And we talked about the colors of food. We know that carrots, pumpkins, and potatoes have colors in the yellow spectrum, and therefore they benefit the spleen and stomach. We know that from the color. Again, the red, we know the Honghua lets us know it's good for the heart. Same thing with sorghum. Here, things like carrots, pumpkins, and potatoes, their color also is yellow. We know they benefit the spleen and stomach. We also know that if there's a cold stomach pain, we also know, and we're jumping ahead a little here, but we're going over some questions you may be encountering through the Halcyon learning process. We know pork stomach with white pepper is great for warming up the stomach. And if there is gastric ulcer with bleeding, we know sanchi powder with fresh lotus stem, lian wu. Am I getting that right, lian wu?
Yeah, and also probably
juice and
to
eggs
be
too.
Finish that arterial system, then we will be take a break, then we will go over the digestion system.
So I'm zooming ahead a little. Just go over a few more questions. We're going to get back to our system. Yeah. For hypertension and high cholesterol, we are consuming things like shancha with juhua and tocha. Makes a nice tea. So shancha, the hawthorn berry, juhua is a little chrysanthemum for the hypertension also, and with a little tocha or pu'er. Tocha is more of a generic name, pu'er very specific for that type of black tea. Black pepper steak is very warming. It's a tonic. Peanuts pickled in vinegar, lower cholesterol. So that's an interesting one. And also want to go over just 3 more questions and we'll get back to our presentation. Pineapple, feng li, is sweet, sour, and neutral, is rich in many nutrients, including a digestive enzyme with anti-tumor properties. And pineapple eliminates food stagnation. Interestingly, to prevent some of its acidic qualities, you can soak it in just a little bit of water with salt. It cuts the acidity on it and makes it a little bit sweeter. Avocados are rich in vitamin E and folic acid. And finally, honeydew melon is sweet, cooling, enters the heart and stomach channels. It generates fluid and clears the summer heat. So I just wanted to go over a few things, and if you have any questions, we'll be taking a look at a lot of these details later. So let's get back to our presentation, Jeffrey.
Yeah, we're still working on the arterial system. Okay, beside the heart, I think also we want to be talking about a topic is something related with the lower portion of the body, the arterial or whatever the vein system problem that we call Jin Liu, whatever the name in Pinyin, but that's in English we just call varicose veins.
진료.
Jinliu. Why then? Because they look like kind of pop up something like vein or whatever look like tendons. Okay, so then we talked about that. It's kind of liu system. Liu, that meaning just say like a small tumor or things like that. Okay, that actually same thing too in our acupuncture office practice. Many patients, especially elderly and also the female, then they will be suffering from that disease. So then in the Western system, I don't think they had much things can do. Usually they just say, okay, you be just wear the elastic, something sock, okay, the pantyhose, okay, to help because we know that what is the problem related to varicose veins is something like an anatomic defect, because the valve on the veins, they had leaking. So then the blood cannot go up. They just keep continue to go down because the earth power, that's why the varicose veins always happen in the leg, because the grabs power, pull everything down. Then people suffering from that, they can be had two type of the in the clinically had two symptoms combination with that. One will be what they especially female, they can be had. One will be had like a more, of course, varicose vein, but they will be combination with the edema. So then you can see, sometimes maybe in the clinic, the older lady, they want to treat something like a pain problem. Okay, then we do the acupuncture. Then when we roll up the pan, then we say, the whole leg is something like purple, but varicose veins, and also pain, and also edema. Okay, so that's what we can be. Of course, exercise is one of the important issue, but beside that, dietetic treatment, it will be help. Okay, then how help then? We can give you one of the choice, that recipe will be especially for the varicose vein, but with edema. So the ingredient will be very tasty and simple. One will be the 吃消豆. We talked about something suki beans or any kind of red beans. It will be related. Okay, like we mentioned, because the red bean is something associated with the heart, but at the same time, because that in the herbal category is belong to promote, like dampness. So then beside that, we will be another will be yi ren. The same thing too. The categories belong to promote the the edema category. Then also will be had dang gui. The percentage we need to be know, like 吃消豆 and yi ren, we will be cook it as like congee, so then we can be put large amount. But the dang gui, we just put somewhat, okay,
Little bit,
or you can be what after you cook it, the dang gui first to make a soup, then you take out the dang gui, okay, then. Because the soup still will be had, the dang gui, the function. Then another herb, same thing too, huang qi. So we select those kind of herbs will be what is follow that condition, but at the same time the taste is good too. Okay, because we know that 吃消豆 yi ren is working on the dampness, but the dang gui, that will be what is evacuating the blood, because that's what the varicose veins. It's belong to the blood stagnation system in the T-cell.
So Dongui or Dongui Wei even stronger.
Yeah. Mm-hmm. So then, because the huang qi is a lot of fiber, you cannot eat them. So we need to how to handle it. So first, like I mentioned, probably use the dangui and huang qi to make like a decoction first. Then later on, you take them out those herb. Then you use that decoction to be cooked 吃小豆 and yiren.
So that's the soup stock.
Yeah,
and,
soup stock and very good taste too.
So a dangui huangqi soup stock. Then we put the chishado, which is the zuki beans, and the yiren is very mild, so we can cook that. Which, we often see yiren as a powdered called job steers or pearl barley. We see that as breakfast powders. It's very mild, so there's many ways to do that.
But for complete this recipe, don't forget to put another important we call like a leading channel. Okay, why then? Because now we talked about the vertical veins is always on the leg. Okay, so then for the tasty and for the function stronger, so we need to put one or that kind of like a leg on the animal. That is the cow. So then we call beef shank. So then will be what? That kind of one is more tasty, but beside that, that is one part of the beef in the beef system is considered more healthier. Okay, why then? Because the shank is not that much fat, but instead inside we have many tendons. Okay, because in the human being too, when we talk about the vertical veins, the small suffering, those kind of area is on the on the leg. So then the shank is one of the kind of like associated the location from the animal to the human being. So that also tastes very good too.
So this is leg-to-leg theory for the beef shank.
Yeah.
We see this, we've cooked with beef shank stew for benefiting the tendons in general and the ligaments in general, because why? It's the collagen there, the tendons are there, so it's tendon to tendon, but it's also now for varicose veins, leg to leg as a channel leading herb, the beef shank.
Yeah.
Jeffrey, and I've asked this many times before, and I think I know the answer. Lamb shank is more common in a lot of markets. It's more warming, right? So same function, you think, or beef shank?
Yeah, it's almost the same function, but because generally, I think in the Chinese cooking, whatever, like you can go to Taiwan or anywhere, we call like beef noodle.
Right.
Mainly, it's not used the steak beef or any kind. It just it's the good beef noodle soup had to be used the shank.
The shank.
Yeah. Why then? Because the shank is more soft. You can chewing, and also is less fat, but they have more tendons and more collagen. Okay.
Right.
So that will be what is more healthier than another beef.
Right. So it's a great cut.
Yeah.
For its lean properties, and so the beef shank is specific here. If someone is very cold and deficient, we can take advantage of the warming properties of the ubiquitous, ever available lamb shank, and we can replace if we had to. But beef shank is the choice, and if your butcher can get it, beef tendon. So if you can get some of those tendons from the leg, you can actually put it in
also
the stock.
because the cooking way, the beef, not every part when you cook for a long time, they will be, as long as they can be more soft or tender. For example, like a steak, you cannot use the steak to be make that kind of soup. Why then? Because the steak you only just can be barbecue to make them like not too long, like
tough,
a medium rare or something. Then will be more juicy and more like easy to eat. But the beef thing is the opposite way. So you need to be cooked longer the time, then they can be more like chewing, more soft. That will be match that kind of idea. We need to be just, to make the tendons is, more chewable, to be benefit, to be get the collagen.
So this is our culinary guide today. Is the beef shank just does very well with cooking for long periods of time. So just a quickie review. We've already reviewed this before, but I wanted to go over this again. It's all about preparation here. Azuki beans can be cooked, but again, make first a dangui huangqi soup stock. Now we've got herbal grade soup stock. In the clinic, we can give these ingredients to our patients, no problem, right? So then we
No.
just, so they can go home and cook. Say, oh, well, I can't get it. Then you just give it to them. Okay, so then once we have the soup stock, we don't need to use the actual herbs themselves. They're too much to eat. Then add the chixiao dough, the azuki beans, and the yi ren, and beef shank. And so that will soften
actually,
over time.
Adam, I want to ask you too. If you use it, lamb shake is easy to in the market, right?
Easy.
But then after you cook a long period of time, how's the taste or how's the? Because I never eat the. Only I just eat like lamb chop or something.
Yeah.
Or rib. I mean, but never to
the
make
lamb shank.
Yeah, the lamb shank to cook. So then, how the situation?
Good question. I am not the culinary expert on that. I don't usually eat lamb. I don't know why I don't like it.
Okay. Yeah.
But I do know it has the warming properties. I do look for the beef shank.
Yeah.
And then in a lot of butcher sections, they commonly have the lamb shank. Beef shank also available widely.
Okay.
But more commonly, I've seen lamb shank. So, no, I haven't cooked with it just because I personally don't prefer the flavor. I also don't run cold and deficient. I suppose if I did, I would have a natural appetite. And that's something that's very important about Chinese medicine dietetics. If I were a cold and deficient individual, if I had yang deficiency, if that was my issue, I would probably have a natural appetite for lamb because it's so warming. I would gravitate towards the foods as the appetite is a form of natural intelligence. It guides us to what we need. We just need to distinguish between our genuine appetite and our compulsions. So, for example, maybe I want a chocolate bar or some sugar. That's to be distinguished from the body's natural appetite and how it naturally feels after eating, that good feeling we get from the foods that genuinely nourish us. So we need to distinguish between our body's natural appetite, which is a form of intelligence, and compulsions. But apart from that, if someone tends to run warm or yin deficient, they will gravitate towards a more cooling food. They may like fish more. They may like more neutral foods. Even like beef is neutral to slightly warm, whereas lamb is very warming. Goat is very warming. Also, deer is very warming.
Okay, so then we can be also introducing another recipe that will be more effect to the blood stations. That meaning what the patient vertical vein, but also will be had a lot of purple color on the leg, and also will be had more painful. That will be more related with the blood stasis. So then we will be still use the beef shank, make soup. But the combination, the herb will be some different. We will be choose more like incorporating the blood, those kind of herb. Such like what? We will be using sanqi powder again. And also we will be using like huangqi, dangui, and honghua again, saffron. Then on the end of the after cooking, we can be add some yellow wine on that too. Then one of the idea I think we had something patient ask the question related with the on the before we talked about the angina pain, we mentioned that too. So because the alcohol is one of the kind of agent to be incorporating the blood. Whatever we use it, white baijiu, or yellow is called huangjiu, or red that will be hongjiu, like red wine.
Red wine.
But some patient reported say, "Oh, I had pretty sensitive to the alcohol, so I cannot take too much those kind of alcohol." So how we handle that? I can give you the suggestion. The same thing too is come from the old wisdom, because that kind of alcohol, if people like it or they can drink it, so then after cook, then you put the whatever those kind of huangjiu, baijiu to be on the end of that. But if you sensitive to the alcohol, another way we can be still can get the benefit from the alcohol, whatever huangjiu, baijiu or hongjiu, but will be no side effect from those kind of alcohol content. How do that then? So we will be, I think when we some like herb formula, we talks about say by baijiu tang or any kind, then they will be mentioned that how the way to cook this baijiu. You have choice, okay? So then you want to be very minimum the percentage of the alcohol volume, but you still want to get the benefit from, because the alcohol is still kind of like important ingredient component inside the formula. You cannot without that. So then you can be like a half water, okay? Then you put like something like a half bottle of the alcohol, but then you're boiling together at the same time. For example, like 1 hour. Then 1 hour later, I think the soup, the alcohol is
evaporated out.
But they still will be remain some kind of things inside the soup. I don't think they will be 100% be gone. Okay, so that's what the meaning. We still can be using that kind of method. So to be according to the patient condition, we still need to be using the alcohol. But how do it? You need to be cook longer, or put on the end of the last. Okay, same like we put something like something up like zisuye or whatever those things, put on the last 5 minutes, so you can be choose.
Right. So, but in this case, the standard preparation technique is huangjiu, the yellow sake, and then sanqi, huangqi, dangui, honghua. And what you're suggesting is, and even that is mild because we cook it for a long time. But then also half and half with water. But what Jeffrey's also referring to is to have higher alcohol content. You add things like rice wine later, just, or last 5 minutes, or steep, just like you would add leaves.
It had to be all related with the patient, the condition or whatever they like it, okay? So we be, that's what the important thing. We need to be like all those kind of whatever recipe or whatever the formula. That's what the main idea from the TSAM. It's not everybody the same. We need to be like a soup. We need to be tolerating, to be fit for your body. So then that recipe or whatever the formula too, not like a recipe. We just prescription. So okay, you just take that aspirin. Everybody same, or we need to be had to be individually. So that's what the main idea on this, recipe too. So then the alcohol, we will need to be how, handle, the percentage. But we still need to use the beef shank again in order to be more effective to that, vertical one.
So for the second soup, back to the beef shank. And this is a common one. And we also use the beef shank soup. We've gone over this in other programs where people have qi and blood deficiency issues with muscle and tendon pain. So we take the beef shank soup with also with gugen.
That would be,
which is something that we do for just general tendonitis, muscle aching due to qi and blood deficiency or overexercise. Great for athletes. So, and then you add like gochitsu, celery, carrots, gugen. So you can buy it in the store as kudzu root, which is a Japanese term for gugen, or from your herbal supplier, you can get gugen. And then with the beef shank, again, the same idea, because of the tendons and ligament, the collagen content, it's a great way to go for that condition. Here, return of beef shank as a culinary choice, particularly for varicose veins, leg to leg and tendon to tendon. So something very important.
And also something too, like the why, even though the color, why we choose the the yellow, then actually same again, like 5 element things. Okay, why we choose the red, white too? So that will be something associated with the the organ, because then here the yellow will be more tonified and more related to spring qi. Okay, so then actually we talked about in here, because the vertical went beside the blood circulation, and that's why we put the huang qi there, because generally speaking we say the like the middle qi. What's that then? That is related with we like grabs all the organ in the right place. That's what we call spring qi, okay, or middle qi, the function. So that's what they kind of like yellow wine or beef shay is related with that kind of idea.
So
and huang qi also.
So the yellow color. So we have huang jiu and huang qi, huang and huang, benefiting the middle qi. Also beef shank. And then we also, huang qi also helps go through the channels a bit. We know we mix it traditionally with di lung, which I'm not recommending necessarily for this soup. Maybe not so flavorful to use.
But actually that is the main function,
right?
Main formula for after stroke, the symptoms.
Right.
We say like Bu Yang Huang Wu Tang or
Bu Yang
something.
Huang Wu Tang.
The main ingredient is huang qi and di lung.
Right, which again, the huang qi helps move through the channels. The di lung moves through the channel. The huang qi has that qi to push through the channels along with it. That's a classic combination. So here we see it for varicose veins, the huang qi, but we also know the Buyang Huang Wu Tang is very famous for that, the huang qi di lung combination. Maybe for culinary purposes, we can leave the di lung out today. Again, this is a culinary soup.
And actually this recipe, even though we put a title, is like, say, Jin Liu or whatever, vertical veins, I think it's also very good for like after stroke, people who had, paralyzed on the leg or, paralysis, that kind of condition too. Because they had the same way. Some will be, had edema, but some will be atrophy. Okay? So then we need to choose somewhat different kind of recipe. But the beef, the shank will be always good.
A good choice for people fighting paralysis. Yeah. The tendons, the collagen, the medicinal property of beef shank in particular is great for the legs. It's great for varicose veins. It's great for the muscles and tendons. So again, a beef shank soup is definitely a very powerful way to go. It also, again, it's a channel-leading herb is the beef shank itself. And so we can mix it with the san qi, the huang qi, the dangui, and the huang jiu in the soup.
Okay, I think, do we have any another, question or something, the coronary system? And otherwise we can be,
yes.
Later on we be, take a break, then also we be go to another big system, because the digestion system or the last seminar, we didn't do it at all.
So we're going to do the digestive system in a little bit. We'll take a little break. Let's take a brief review of some of the things we went over. In coronary artery disease, several herbal foods are very important, and this one recipe can be very helpful. So it's shanjia, hawthorn berry, henghua, which is saffron, and xiebai. Now, xiebai can be replaced with shallots if necessary. Remember that the herbal xiebai is more potent than shallots, but nonetheless, shallots have a similar function for benefiting patients with coronary artery disease. So shanjia, henghua, xiebai. And you can cook them or just use hot water and boiling hot water and soak the above. And these make a nice spicy soup for the prevention of angina pain and benefit arterial health. So again, individually, each of these are very healthy choices for the heart. Think about patients with heart conditions, how they can start to include these ingredients combined with different dishes in soups. So that's one of the recipes we went over in this presentation. Another item we went over was that sorghum, galliang, is a grain that benefits the heart. It's a major grain, especially in parts of Africa. Also chives. help with angina pain. You can use the juice of the chives. It's very strong. One can mix it with red wine and drink it for that invigorating the blood property. Again, a little bit every day to help prevent coronary artery disease. Also covered was the use of sanqi powder with Henghua. So that can be made as a decoction to benefit patients with coronary artery disease. Also, it can be mixed with shanjia, so sanqi and shanjia as a decoction, or sanqi and Henghua as a decoction. So adding either the saffron or hawthorn berry to sanqi. Of course, sanqi powder with heimu is also good, and heimu very strongly invigorates and thins the blood. So this can be prepared with chicken or lean pork meat as a soup. So sanqi with heimu which is we call black fungus. Sometimes we'll actually see that in restaurants in the black fungus as hot and sour soup. You'll see a little bit of it. And again, sanqi, black fungus, chicken, or lean pork meat as a soup. Also to benefit patients with coronary artery disease. Again, these are dietetics preparations, so they're healthy lifestyle choices to prevent the disease. Again, dietetics is not taking the role here as an emergency measure to reverse the disorder, but rather as a long-term process in someone's life for healthy living to prevent these issues from occurring. Another topic covered was varicose veins with edema. So taking Chishao Do with Yi Ren, Dangui Wei, Huangqi in a beef shank stew or soup. So Chishao Do, Yi Ren, Dangui Wei, Huangqi in a beef shank soup. Also, varicose veins with a kind of purple skin. Then we were using sanqi, huangqi, dangui, henghua, and of course with huangjiu in a soup. And so those are some of the topics we covered in the cardiovascular section of our course. I want to take a moment to go over a couple fun things that we've talked about many times over. And one of them is how to keep your voice well. And we talked about this a bunch, so let's take a look. Why not? We went over Pang Da Hai and how to use Pang Da Hai to soothe the throat in other webinars. So here is our herb Pang Da Hai. Let's get a close-up right there. So it is a fruit. It's dried, and you can get it from your herbal medicine supplier. So Pang Da Hai does expand in hot water. So I will show you what it looks like. You can drink the water and eat the fruit, no problem. So let me see here. Okay, so here is when it's starting to expand in hot water. And then finally it will expand. And the longer you let it soak, the center will get very soft. Looks a little like a jellyfish, right? Let's see if I can get in close. But it's fruit. And so you can see the Pang Da Hai. It's very soft. It's slightly sweet in the center, relatively flavorless. You can drink the water. You can eat the fruit and the whole thing. Because even though it looks like a nut, it expands very soft and it will protect the throat. So it's great for a long lecture. You can even put it in your pu'er if you want. You can mix it with muhu die also to make it even stronger. And if you really want to make it strong, then mix it with hei zi. Or you can just suck on the hei zi. It's very strong. It's a very powerful astringent properties. But that's our Pang Da Hai. We've talked about it many times, and I thought it'd be fun to go over. And we'll beginning. Jeffrey, are we starting with gastric ulcer?
Yeah, we started all the digestion system. Actually, some recipes very interesting too. Right now we started for the common problem with the gastro system ulcer. So there will be we know that, like we mentioned, that kind of disease now will be increased. You know that in United States, you can go to before like long drugs now called CVS or whatever, Walgreens or something. You can see how many different kind of medication to dealing with acid or or stomach ulcer problem. So then we later we talks about the acid, but now in the slide we talks about first is kind of use it something like dietetic things to treat the stomach ulcer, even though they get the bleeding. And also why that kind of stomach bleeding or ulcer, the patient number is increased. One of the reasons now, because it's very common to use the blood thinner. Some will be like a prevention for people when they getting older. So then the doctor usually, okay, you need to take like a baby aspirin or whatever that kind of associated product to prevention you get stroke or you get a heart attack. Then even though it's baby aspirin, you take a long time. For some people, they will be developing acid or even though ulcer or even bleeding. So some will be what they cause the big problem because the stomach bleeding, they can be kill them.
Right. So stomach acid, a huge problem. People on long-term pain medications, people who are trying to use baby aspirin as a blood thinner, especially if they're not using a buffered aspirin, people can die. I've literally had people come into my clinic on pain medication, and also that caused an acid problem, and also over-the-counter pain medications like ibuprofen, combined with taking baby aspirin also many years. And the doctor says, no, you cannot take either anymore. So then they like acupuncture for stopping pain. Why? Because that's all they have left at that point. And then hopefully we can do a good job for this issue.
Okay, so now I will be introduce one of the kind of recipe. It's simple. You can get that in the any kind of the supermarket. First, we need to get the fresh lotus root, 莲藕. Like I mentioned before that kind of lotus root, they always use it like canned food, but now because the market demand, now many Asian market, they selling fresh lotus root all season. So then we bought those fresh lotus root, then we make juice. Because actually the lotus root, if we know, the TCM herbal medicine, one of the stop bleeding category we call 藕节. That actually is the dry lotus root, the joint. But now we use it that is more like a fresh one. Yeah, like that, in the picture we can showing. That's what the very common selling all the season in the market now. So then we will be make fresh juice with those lotus root. Then after that, we drain the lotus root, the juice, we crack the fresh egg.
Fresh egg and fujian.
Yeah, the 藕子 actually.
藕子.
Yeah, 藕节 is the joint, but the 汁 is the juice.
Let's get that in there.
Even though people, the general public, they just can get those too. But for the acupuncturists, if you had sun cheap powder, so that will be make that recipe much stronger. How do it? Like we mentioned, first you make the juice. Then you crack the fresh egg. And also the powder, you all mix up. Okay? So there will be what? It look like kind of like cup of the somewhat like juice, okay? But heavy juice. Okay?
So raw egg, sanchi powder,
and the
oats,
main things is the fresh lotus juice. Then you just drink it, that combination. Then we know that because the fresh lotus juice is same kind of character like Ojie, because usually we put the Ojie is put it in the formula.
Mm-hmm.
Then we be cook it like a tea, but now we use it that is like a fresh one, okay? Then even stronger, okay? Because you mix it with the sanji powder. But if some people they are just like general public, they don't have sanji powder, that's okay too. You just use it the juice, then mix it with the fresh egg. What's the function? And because the juice, they will be like make shrinking a little bit, okay? Because that will be same as like we talked about nature is shrinking, okay? Stop the bleeding, okay? Then the actually because they have somewhat related with ulcer a little bit, that's what the bleeding come from. So then that will be had something like cover up, with the egg, the white and the egg yolk or something. They
the soothing,
yeah, to make to be have the just like basically we say what the stomach ulcer that it sounds like we have the skin wound, okay. So then one of the easy way when we had the wound, they are irritation, they bleeding, then we can put something like aloe vera juice or something to be put
on
over
the wound,
there.
yeah.
So that's what the idea is, similarity.
So
but it's come from the
raw
food.
egg helps to seal the stomach wound.
Yeah.
Whereas
seal
something like honey or aloe vera on the skin externally.
Yeah. Like same kind of idea.
And so here we are using ujie, or otsu, the juice, in that capacity.
Mm-hmm. But if some people they just had like a stomach cold kind of stomach in the TSM system, talks about people who will be had stomach pain. Of course, they might be had ulcer, but then they will be different type. Then they will be just feel that whatever they eat something like ice cream or very cold kind of food, then they will be get the stomach pain. So then we need to be switched to another recipe. So that will be what stomach to stomach again. So you can be easy to buy it, the pork stomach in the market. Then come with white pepper or black pepper. It doesn't matter. And even though we had one or another, we didn't put on the PowerPoint, they will be called Gao Liang Jiang. It's ginger anyway. It's kind of ginger. Because they are like pepper or ginger, they have become belong to like a warming system. So then we be cooked with the pork stomach. You also can put the lian-o too. The lotus root, the fresh one. That will become a kind of very tasty, the soup. Then you can, the lian-o, whatever, the lotus root, and the pork stomach, you cut it in small pieces. Then you can dip it a little bit like soy sauce or something, as like a food to eat, like on a meal. Okay, so that's one of the kind of idea.
So I think the Gao Liang Jiang in Thai cooking is galangal or galangal.
Uh-huh.
So we have the some access to that in health food stores, markets, Gaoliangjang, for warming the stomach. Stomach pain due to cold injury, due to deficiency and yang deficiency in the stomach. So people do get those kind of cramping pains, a terrible pain. So the different gingers are good because they're warming, and that one in particular is available, Gaoliangjang, in a culinary aspect because of Thai cooking. So that's kind of interesting.
And also I will be introduce another very good one too, another recipe. Now we know that people who got GERD or stomach ulcer, they are similar but a little bit different, because the GERD main things is what is the, between the stomach and the esophagus, the something like head muscle to be controlled, the open, and it actually is kind of like hernia. So some people will call hiatal hernia. Okay, so that situation will be what people will be get like feel heartburn, but that heartburn is different from the coronary disease. They only the feeling will be look like heartburn. In the Chinese and English, it's the same. We use the heartburn too, called symptom. Okay, but the cause is totally different. So then will be what the etiology or whatever pathophysiology is because the stomach had too much acid. Okay, then will be what? Then they also will be backward to go through the esophagus, then go out to the throat. So then actually the people will be feeling, something, they will be have something like sour taste all the time on the mouth or throat. So far in the Western system, it's all used actually before they will be using simple things, say alkali, to neutralize the acid. For example, just like baking soda. But now, of course, they will be improved to more to the root problem, because when you use it just like a neutralize, okay, too much acid, then we be using baking powder, something like that, to be neutralized. But then the stomach still continually to produce the acid. So now they had before it actually is had to be prescription, but now will be what is all available in the drugstore, is whatever the name called H2 blocker, or whatever they call PPI, proton pump inhibitor. It's not very good. But that if people, because they had to be daily basics to be take that every day, and otherwise then they will be have problem with the acid. But those products, if take too long, because they are not neutralize the acid, actually they just stop the cells, because where's the acid come from? The acid is come from the stomach cell to be, that's natural function for the stomach cell to promote the acid to help to digest the food. But now that kind of medication to be what? To stop it. I don't think that's natural things, okay? So it's too long. It might be cause something like, changing the cells. Then we be make, even though, cancer or whatever, those kind of thing.
So this is a very, very important point. Look, it's okay to cover up symptoms until we can fix it. In Chinese medicine, we can fix gastroesophageal reflux disease where there's excess acid. We feel it coming up in the throat. There's burning, what we call heartburn. But proton pump inhibitors can lead to gastric cell atrophy.
It is, yes.
And if we get gastric cell atrophy, that leads to cancer of the gastric system. So long-term use of proton pump inhibitors for GERD or any kind of acid problem is strictly forbidden in the sense that you are risking cancer. So GERD, again, gastroesophageal reflux disease, is a chronic digestive disease that occurs when the stomach acid or occasionally the bile flows backwards. It refluxes. into the food pipes, into the esophagus. And the backwash of the acid irritates the lining of your esophagus and causes GERD signs and symptoms. So again, you get that acid reflux, that heartburn, digestive problems. But again, Jeffrey points out not only cancer is an issue, but also poor digestion because of artificially diminished acid. In Chinese medicine, we have many ways to eliminate this condition, particularly with herbal medicine and here with dietetics. So this is something that in the clinic, if people come in and say, okay, you can take your drugs, it's okay. They can take over-the-counter medication, you can take your doctor's meds. But if they take our recommendations with diet, if they take our recommendations with herbs, eventually they will just not want to take the drugs because they will not need them. So
okay, so now I will give you one of the kind of very natural. We actually had that kind of similarity, like the pet medicine selling in the market. But now I just use it the dietetic, like a cooking method to be replaced even to the pills. How do that? One is the very natural and the very common and the economic you can buy in the market will be called hai piao xiao. So what's that? Actually, it's just cuttlefish bone. Then you probably asking where we can get it. Actually, in the many market, we can get the whole dry, the cuttlefish. Then they is including the bone. So then we can be using that dry cuttlefish to make a soup, okay? But you want to be make stronger, so then we can be take that cuttlefish out. Then we powder up. So then what will be look like? That will be look like kind of like a little bit salty taste, like a white powder. Then we will be come with hei zima, sesame. But same thing too, we make powder.
Black sesame.
Yeah, black sesame. Then you can be put somewhat honey, okay, to be all mixed up. That will become a cream. Then you can be make very Western, style or the kind of cream. So what the kind of cream is, you can actually make like a sandwich. Put the paste, like a peanut butter.
Right.
Okay, then you put on the piece of the bread. But then how work this combination? But if, on the traditional way, we say the hai piao xiao is belong to like Asian category. But actually, if we use a modern idea to be take a look, what is the hai piao xiao then? Hai piao xiao basically is like calcium carbonate or something. Is something very similar to like kind of like baking soda.
Right.
Okay.
Right.
But it's more like dietetic food, so won't cause something like chemical or too much, those kind of problem. So then we can be recommendation. The patient is use it that hai piao xiao and the whatever cuttlefish bone powder, mix it with the sesame or honey, but the percentage you can adjust a little bit by yourself. So that will be what is similar to like if we taking anti-acid medication, like we mentioned before, something like a PPI or something, okay? But they won't, when they won't have something to the cells level.
Right. So long-term, hai piao xiao is safe. Mm-hmm. Hai piao xiao, also known as wu zhe gu, is cuttlefish bone. It is astringent. It's slightly warm, slightly salty, and astringent. Enters the kidney, liver, and stomach. It stops bleeding, astringes the kidneys, and harmonizes the stomach by inhibiting gastric secretion. So again, crushing the cuttlefish bone to a powder.
Yeah.
Mixed with black sesame, making a paste. And again, you can use a black sesame powder mixed with honey as a great spread. And even from your herbal supplier, you can simply ask them to send you both of these in powder form.
Yeah,
So,
or
great.
actually that if you send you ask the Herbal, the wholesale, they can be send you the whole package of just the hypalcel, the cuttlefish bone, with very economic price, because those things is the common food for the Chinese people diet. So then will be what hypalcel will be very soft and very easy.
Easy to
you
work
can just
with,
use
yeah.
it with just not heavy duty, like something like coffee bean, grinder, machine
Grinder,
or something. Then you
yeah.
can just make
It
grinder.
is kind of light,
Very
Very
simple
soft, yeah,
and
yeah.
very effective. Then one of the very common pet medicine called Dietary. Many patient feedback say is working pretty good. What's the ingredient Dietary in that? It's just only hypalcel, yang huso, and honey. That's it. But they make pills. Okay, but now I put these things, there will be, something like what? Even though you can be just eat like a bread, okay, or like just say cream. You don't need to, if you don't like it bread, you don't need to use it as bread. You can just use it the hypalcel, milk powder, then you sesame milk powder, then you put the high boiling water, you stir, it become a cream. So you can try it, okay? So now will be also, it's still, the digestion system, but now will be, not the stomach ulcer, but will be lower part. Not very common, but we can be treat something like once a while, we had the patient to come to see you in the acupuncture office, talking about like an ulcerated colitis. That is somewhat very difficult to treat the disease. In the Western medicine, they talk about the ulcerated colitis is related with unknown reason. Okay, so then will be what? Related with something like an autoimmune disorder. Then the people who will be had the pathophysiology changing, similarly like a stomach ulcer.
Jeffrey, I wanted to back up for just a second.
Yeah.
We had a little technical difficulty there.
Mm-hmm.
So I did want to review the previous slide. Can you take us back to the previous slide?
Yeah, okay.
We had a little audio technical difficulty, and thank you everyone for alerting me to that. We basically had gone over stomach ulcer and stomach acid.
Mm-hmm.
We mentioned that uzi, which is the juice of the ujier, with sanchi powder and raw egg, is great for lining and coating the stomach.
Mm-hmm.
We covered GERD, which is gastroesophageal reflux disease, and also. I think that kind of quickly wraps up what we did there. And please feel free to ask any other questions too. But we definitely recommended also a black sesame with cuttlefish bone, which you can get in the marketplace, and honey as a paste or a spread. Mm-hmm. So it's wonderful. Remember, cuttlefish bone is easy to grind up in like a coffee grinder. Mm-hmm. You can also get it from your herbal medicine supplier. So black sesame, heizuma, you can get over the counter at a marketplace, and then that can make a spread like on a sandwich or what have you to also balance the stomach acid. And long-term, remember, proton pump inhibitors can cause gastric cell atrophy and therefore cause cancer. So again, if anyone has any technical difficulties, always let us know with any of our webinars at www.healthcmi.com.